Hello everyone. My name is Dr. Lizzie Croton, and I have recorded this set of talks to help GPs during the COVID pandemic of 2020. And in particular, we'll be looking at mental health and some tips about conducting remote consulting over video, but this also can work with telephone as well in many aspects. I'm a GP currently working close to a university in the Midlands in Birmingham, and we have a number of patients with mental health problems, and we at the moment are conducting all of our consultations, or the vast majority of them, using video and audio. So these are just some tips that I've put together, and I hope you find them useful. So, before you call the patient, it's helpful to get the basics in place. So, this would involve having a look at the patient's notes and um, seeing if you can work out why they're booked in with you. Is it a new patient? Is it a follow up? Some idea of what the problem is. Um, and just get an idea of who the patient is before you call them. Then once you've called them and you've got them on the video, you would want to verify their identity and ask them for their date of birth. You could also ask them for the first line of their address as well. Just check that you've got the right person. This is easier if you know the patient beforehand, but it may be that we will be consulting with patients who we may not know in the future if we're working in hubs or cross-covering for other practices. It's important to make sure the patient's in a quiet place, ideally in a quiet room with good lighting so that you can see them. Um, it is helpful to check that they're on their own. It's possible that there may be people off camera that you may not be able to see. So just check with the patient that they are in a private place. When you are talking to patients, it can be useful to remember to look at the webcam rather than looking at the picture of the patient on the screen. This gives a more natural gaze, and it can be better to have a look with just one eye as opposed to both, because it can create a kind of starey look which can be a bit intense. Some patients, depending on how they're feeling with mental health consultations, may not want to see their picture on the screen. This is something that we found through doing digital consultations. And if that's the case, you could suggest that they put a post-it note over their screen so that they can't see themselves, but you can still see them. So these are just some technical points which can be useful in this setting. Following on from this, let's move on to the consultation. I like to start with an open question, like what brings you here today? It may be that you already know why they're there. They might want some medication or something, so you may start with good morning. I understand that you're looking to get a repeat prescription for your medication, and that's fairly straightforward. And then following this, it's really important to listen, to actually listen to the patient's story. We're very good at this as GPs. We do this day in, day out. It's helpful to observe what the patient looks like on the webcam. A lot of webcams now are very, very good, so you can actually see the picture is really, really clear, and this is actually really helpful. You may want to observe, how they're dressed, what their appearance is like. Are there any obvious emotions? Their behaviour, do they appear calm? Do they appear agitated? Are they tapping their foot or cracking their knuckles or doing something that would suggest there's some tension? What's their voice like? Do they sound anxious? Have they got a kind of a rapid fire voice? Are they quick to respond? Or do they appear slow in speech, perhaps suggestive of depression? And their cognitions, what type of thoughts are they using? Listen for things like all or nothing thinking, catastrophic thinking, or depression type thinking, where people are saying it's terrible, it's awful, I feel really low. And just listen, really, listen to the story. And stay engaged, keep looking at the webcam. Make sure that you don't have any distractions on your end. It's helpful to turn your phone off. It's helpful to stop people coming into the room if you're consulting from a practice. And following this, it's really important to, once you've got an idea of the story and the history and how the patient appears, just the basic mental state examination that we learned at medical school and we do every day. It's important to assess risk, and this is suicide risk. And I'm going to do a separate presentation on this, which will be available as a separate presentation. But I think it's always important to ask about risk and document that. And when you're chatting to the patient, once you've listened to their story and you've observed their behaviour and you've asked some pertinent questions like, how long they've been feeling like this, how is this a problem for them? It's important to ask what's important to them and what are they looking for, because this is really important. People often feel quite disempowered and powerless when their mental health is not good, as it were. So what are they looking for? In an ideal world, why have they contacted you today, and what were they hoping that you could do? Following on from our history, listening to the patient's story, asking them pertinent questions about how they're feeling and doing a mental state examination, it can be really important because everyone is at home at the minute. They may be living alone, they may be living with relatives or friends. It can be really important to get a collateral history, and this means talking to relatives or friends, obviously with the patient's consent. This is really useful because it gives you an idea of who else is in the household and what kind of support the patient has. One of the big problems with the COVID pandemic is the degree of isolation and disconnection that is going on at the minute. And we are finding, certainly as GPs, that it is a double-edged sword in that some patients feel very connected because they're with loved ones, they feel very safe, they feel a lot safer, so their symptoms may get better, but other people may feel very disconnected. They may have to contact friends and family via social media when they're used to having people in their house and people who can come round. And the restrictions mean that people can't meet up or go out or get beyond the four walls. So it can be very, very unpleasant. So it's really useful if you can to get a collateral history as to how loved ones feel the patient is, how they are normally, if they have any concerns, anything that they've noticed. With the patient's consent, it may be appropriate to phone them up and have a chat with them. You could also think about using them as a point of contact in a crisis. We'll talk more about that later in the second presentation. But it can be really useful to use other people because it is a lot for a GP to support one patient. It's impossible. So I think in this time we really need to be looking at what other sources of support are out there, friends, family, etc. That's very important. We can use tools. So the two that I've quoted here are the PHQ-9 and the GAD-7. These are available online in many places. I tend to use patient.co.uk, and my patients are fairly tech savvy. So what I tend to do is to ask the patient to Google these particular scores and then fill them in and give me the answers, give me the score, I should say, via the video. I'll then put that in the notes and actually document that they are reported scores, so they're scores that the patient's given me, and they can be useful in tracking progress and also documentation. So once you've taken a history and examination, from examination obviously being the observation and observing how the patient is on the video, we can discuss the diagnosis and the treatment plan and any follow-up. And this is exactly how you would do it in a surgery. And it is something that we all know how to do as GPs. taking into account the patient's preference. It's worth remembering that a lot of psychological services now, even though there is often a very long wait, are operating remotely and online. So don't assume that places that patients have got support from in the past are shut and not open, because that may not be the case. They may be offering remote consultations, and a lot of the third sector organisations are also very much open for business as well, and have good support networks at this time. So we will talk a little bit later about managing risk, and this is a separate presentation as we've discussed. Part of this involves medication risk, so we may well be prescribing, and we're trying to reduce footfall into the practice, so that may well involve sending a prescription to the pharmacy via various means. And if we're concerned about possible risk or possible overdose risk, it may well be appropriate to issue delayed prescriptions or weekly prescriptions. I think at this time of pandemic, it's helpful to think about ways that we can reduce footfall into pharmacies as well, and also reduce people going out of the house. So we may be more inclined to allow household members to manage medication if we are concerned about the risk of overdose. And so moving on to final thoughts, once we have finished the consultation, it's really, really important to write clear documentation after we've seen the patient. So right after the consultation, to include verbatim comments, if possible, of what the patient said. I think that can be really, really helpful, as it gives a really good idea of the patient's mental state. The other thing which we will have discussed with the patient beforehand is safety netting. This is really important. So this will involve things like crisis advice, and also when we are planning to make contact with the patient again, or when the patient should call us back. If the patient has been started on medication, usually that call would be fairly quickly afterwards. We have a lot of young people in our practice, so we tend to contact them within the week, because they're fairly young, between the ages of 20 and 30. If we're very worried, it might be the next day or a couple of days later. It's useful to go through crisis advice. There are different forms of crisis advice in different areas of the country. So what should the patient do if they feel they're in crisis? Who should they call? Should they call you if you're open? Samaritans, other sources of advice. And we'll talk a little bit more about this in the separate presentation. But it's really, really important also to discuss things like side effects of medication. When SSRIs are started, as we all know, there can be an increase in anxiety, rarely suicidal ideation, but it does happen. And also rarer things like serotonin syndrome, and probably more commonly GI side effects. So these should be spoken about and documented. It's also important to talk about self-care resources, and there's loads of things out there. There's a whole gamut of social media resources, and text services, and many other resources, and some patients will also have their own social media support groups as well, which are important. It's really important to promote self-care so that the patient actually feels empowered that they can do something, as opposed to feeling that they have to contact the GP for everything, because this puts a lot of pressure on the GP, but it also may also, if we can't meet the patient's needs, then the patient may well feel that they are not valued or wanted, and that can lead to crisis as well. So we need to be realistic about what we can offer and encourage self-care as well. And finally, the interval for follow-up, which will be different from patient to patient. If it's a stable patient, we may speak to them in a couple of months. If it's a patient where we're concerned about risk, it may be the next day, it may be later on the same day. And finally, I've included some hyperlinks to the GAD-7 Generalised Anxiety Disorder Assessment and also the PHQ-9. These are available on patient.co.uk. I'm sure we've all used them, and I like these because they're quite user-friendly, and the patient can use them very easily and tell you what the score is. You could also ask the patient to show you their smartphone with the score on so that you can see it as well, because lots of things are becoming very, very easy with the tech. So that's just a quick run through of mental health consulting remotely via video. We'll move on to the next two presentations.